Black women are dying. The rates of Black maternal mortality are rising all over the world. Today, I'd like to discuss this with my guests who are on the front lines of advocating and bringing awareness to this much needed crisis. Welcome, Coach Gessie Thompson, Charles Johnson, and Errol Pierre. Welcome to First Aid with Kelly Kinkaid. Hello, everyone. Thank you for joining me today.
Thank you for having us.
Errol, I want to start with you. Being that you work in the healthcare industry, why are we still experiencing these horror stories? In New York alone, we've heard stories that have made national headlines with Shasia Williams and Amber Isaacs at these hospitals. And they're young girls who you would think they, would have an easy pregnancy, but you hear even with Amber, she was already saying something was going wrong. Even Shasia, something was going wrong. Why is this still happening in our health industry and at these hospitals?
Yeah, Kelly, thanks for the question, and I'm glad you're saying their names. It's very important. It's an interesting fact of what's happening in our industry, and it really comes down to something we call implicit bias. Mm-hmm. And so, just to back up from the stats, they're outrageous. If we filled up a stadium, call it a big stadium, Ohio Stadium, where the Buckeyes play, 100,000 people, we filled it up with all Black women, 40 of them would die out of that entire stadium. For their white female counterparts, it's only 15. And people might say, well, that's pretty good, but it's even like lower outside of the United States and other developed countries. Japan is 9, France is 8, so much lower. So people are dying, these rates are out of control. And what we call it is implicit bias, because what's happening is people unconsciously are making assumptions about Black women that leads to poor health outcomes. Right. And examples like Serena Williams, it's not about age, it's not about income, it's not about education. She has all of those things as an affluent Black woman, and she still faced issues just as someone who doesn't have those things and doesn't come from as much of those privileges that she had. And the results were the same. And so implicit bias, an example of that is, this is a big boned Black woman, dark skin. Maybe she's tougher than someone else. So on a scale from 1 to 10, when we ask her if she's in pain, she says, I'm on pain at a scale number 10. And the doctor, because of the implicit bias, might say, she seems tough. Maybe it's only a 5. So I'm not going to give her medication. I'm not going to listen to her. She's okay. She's a big girl. And those are literally what's happening in our hospitals that leads to these poor outcomes.
When you talk about that with Black women, when we talk about the father, who they consider the father of gynecology, James Marion Sims, the things that he did, and this was in the 1800s, and it was this stereotype, Black women can handle more pain than other women. Why is that still lingering over us now? And I want to bring in Charles. First of all, let me just say, I want to send my condolences. I know your horror story happened in 2016, but it never gets easy. It never gets easy. But, I saw your story all across the national headlines and stuff, and I want to talk about your story. And in addition to you talking about your story, for both of you, Charles and Errol, when we talk about the healthcare system, Charles and Kira, you all were, I'm sure you all had good insurance. This was your second baby. How is it still happening? And let's talk about Kira and your story.
Yeah, and Kelly, thank you so much, first of all, for having me. And I'm just so grateful for Coach Gessie for inviting me. So let's get into it. And in the interest of time, because I can brag about my wife all day, right?
Yes.
So when we talk about Kira, we're talking about, Earth Angel. We're talking about raced cars, ran marathons, spoke 5 languages fluently. We were just chatting about how she lived overseas for 3.5 years. And when we talk about this woman who did everything right, who had access to care, who was obsessive about every single prenatal vitamin. And we made the conscious decision to give birth to our second son, Langston, at Cedars-Sinai Hospital, specifically because we believed and we thought that this was supposed to be one of the best places in the state of California, particularly in the country, in the area of obstetrics and gynecology. We walked in on April 12th, which we expected to be the happiest day of our lives, and walked right into a nightmare. In the interest of time, because I want this to be a fruitful discussion amongst all of us, I'll share with you that what happened to Kira over the next 10 hours was the most egregious example of medical negligence, neglect, and the intersection, as Brother Errol said, of how bias can have catastrophic consequences. We walked in, routine scheduled C-section. Shortly after our son was born, I noticed that there was bleeding in her catheter. For 10 hours, while we begged and pleaded for them to help, for them to take action, they allowed Kira's condition to deteriorate and her to suffer before they finally took her back for surgery. And I want to, both you, I'm just excited. It's giving me goosebumps because y'all are already y'all have talked about so many things that are so pertinent. So let's talk really quickly about what Brother Errol said. It's important for Black women that are listening this to understand that it is racism and not race that's the risk factor, right? Because society will lead us to believe that you're dying because you were Black and there's something inferior with you.
Speak it.
Right? Because you were Black, and that's why you are suffering at this disproportionate rate. When the reality is, like Brother Errol said, it is the bias that is leading to these catastrophic outcomes. And how does that work? He gave a very wonderful articulation about how patients are essentially profiled and then decisions are made, but how this has catastrophic consequences. For instance, we'll kind of come back to Kira's case, Kelly, is that in Kira's case, because there was not a clear standard of care and a mandate for what was supposed to be done when she was exhibiting these symptoms of distress, it was up to the doctor and the staff to say, we'll just see what happens, right? And we'll just see, and maybe this will fix itself. And I refuse to believe that they would have taken that approach if it was a white woman and they were able to see in my wife the same thing that they saw in their sister, their wife, their daughters, right? And so when we talk about bias and racism, if you are a civilian, you have the luxury of working your biases out in your own time. But when you are a medical professional, just like if you're a police officer, your bias can have catastrophic consequences. And that's the problem. And that's what we have to work hard to correct.
Right. Errol, and my follow-up question is, different races have the same type of medical plans. Why is it still having bias if I have the same medical plan and I'm paying the same money, you're not giving me the same treatment? Can you speak on that?
Sure. So there's so many studies that looked at this. There's one specifically around Florida State. They looked at Black children that were born with white doctors versus white children that were born with white doctors. And the stats are crazy. Black children that were born with white OBGYNs had a 3 times higher mortality rate than Black children born with Black OBGYNs. When the Black OBGYN was taking care of the family, the reduction was actually 58% in a death. And so you can have the same insurance card and everything's covered the same. But that's sort of like when you have laws tell you what you're supposed to do, but they don't dictate hearts and minds, right? So everyone has right to medication. But as Brother Charles said, the discretion is being done with bias that sometimes is explicit and implicit. So I'll give an example. The Children's Hospital in Philadelphia, they published a study. This is public data. They actually did a survey on their residents to see if they had implicit bias. There's a validity tool. This is not something you have to think about. We can actually test for this. There's a valid tool from Harvard that can tell you your bias. They put everyone through the bias test. And they found 95% of the residents had a negative bias towards Black adults, 85 had it towards Black children. So what do you think happens? Would you tell and take time in the office visit someone all the specifications of what they should do around prenatal if you think their education is lower just by the color of skin, if you think they're not going to listen to you, if you think it's a waste of time? These are all things that lead to shorter conversations, shorter words being spoken during a physician visit. You actually can document it that, hey, when you talk to a Black patient, it was only a 5-minute discussion. When you talk to the white patient, it was 10 minutes. These are all things why just because you have the same insurance, it's not being applied the same.
What I love about this panel of guests is that we're all striving for solutions. And Coach Gessie, you know, you're on the other spectrum, in my opinion, to Errol being in the healthcare system, because you're now a nutritionist and you have a highly successful Detox Now program. And thank God you're here with us. You know, you have been a guest on my show and on Sway in the Morning talking about fibroids. But let's hear about your story and how you kind of got pushed into this journey of health and Black maternal mortality.
Yeah. First of all, thank you again, Kelly, because you made the space and time for this conversation. You know, last time I was here, I discussed how fibroids at length, you know, we discussed about fibroids at length. And I shared my personal story of being one of the 90% of Black women affected by fibroids by age 50, and shared how in my I say $1 million baby, because it's $1 million plus journey. It included battling fibroids for 14 years. 10 years of those with infertility caused by those fibroids. 15 surgeries at this point, 5 of them to remove fibroids and 5 for complications from the fibroid surgeries, which have now caused me to develop long-term health issue, one called specifically short gut. 5 IVF cycles, nearly 150 plus days in the hospital, and a heart-shattering miscarriage, and not even to mention my heart stopping on the delivery table because of the complications from my surgical history. So my story is full of what medically they call they call them near misses in the Black maternal health crisis. And, you know, I'm grateful, Kelly, you know, I'm grateful because my baby, Nia, and we survived. But as we've talked about it, the statistics are devastating. And unfortunately, you know, what now, because my story, when Essence Magazine published it, it went viral because so many women could relate, right? Because of the pandemic. And not meaning the pandemic of fibroids, because when you say pandemic now, everybody thinks COVID.
Exactly.
But, you know, what happened at that point is that awakened me to the fact that, oh my God, millions and millions and millions of women are battling this, and they're having issues with complications with surgery, complications with birthing because of these issues. And it really now put me on the front lines as an activist, where I'm now working with, you know, through as a nutritionist, if I say a survivor turned activist and nutritionist, because I get to work with women now and help them to take their power and educate them on how to advocate for themselves to actually secure optimal health care and to do what they can in terms of owning their own health, right?
Right.
So something that really sparked for me, you know, the medical bias piece is a huge piece, all right? And again, it crossed the lines across, you know, economic, education, everything, because of the short gut syndrome that I developed. And it started off with a doctor being eager to cut me, Kelly. Why? Because I was a Black woman with fibroids. I was not given any other options. And we talked about how they even try to push hysterectomy on you, right?
Yes.
So they were eager to cut, and that cut led to multiple surgeries, which led to multiple complications. This past August, I actually, because of the short gut syndrome, developed blood pressure that affected, it was a lot of hormone imbalances that affected my parathyroid hormone that caused me to develop an aneurysm. All right, Kelly. I ended up in the hospital. I remember it was August 12th. And this goes back to what I really equip women with is Yes, we're gonna talk about legislation. We're gonna talk about how to get into the healthcare system, but it's about what can we do, right? And the very first thing, I had a headache that was so crazy, Kelly. The only way I could explain it was the worst headache of your life.
Mhm.
And right away, I said, okay, something is wrong, right? Something is wrong. And I reached out to my doctor, and I found out. He said, go to the ER. Let's find out what's there. And we found out that it was an actual aneurysm, an unruptured aneurysm.
Wow.
But here's the thing that drove me crazy is that here I am talking to the surgeons, and he's telling me, oh, I can fit you in the schedule for 8 days from now. So go home and come back. And the words they used, Kelly, was you have a large aneurysm, significant that we have to operate. And I was in so much pain that my blood pressure was uncontrollable. Okay. So they were trying to send me home with literally with your blood pressure being high, it can cause it to rupture. All right. So trying to send me home to say, well, I said, wait a minute. I said, my pain being as high, because I know how to advocate for myself, and I'm able to equip women to do the same thing now. Because I knew, I said, listen, the pain is so high that if you can get the pain under control, then I'll go home. But he said, no problem. A couple of days later, they're coming at me. They weren't able to control my pain. They weren't able to they had to actually come and give me emergency IV injections of high blood pressure medicine to get it down. All right. Like in an emergent state to keep it from rupturing. Why are they asking me? So, Mrs. Thompson, when are you going to go home? Because, you have to check out and you can check in by a certain date so that your insurance will cover it. I said, excuse me? I said, I'm not going anywhere. I said, the only thing that's keeping this thing from rupturing is the fact that you're able to control it with intravenous, emergency intervention.
Right.
I said, so, but I'm having this conversation, having to fight for my life, fight these doctors, right? And I said, in my head, I'm like, if I was a white woman, there's no way I would be having this conversation. There is no
It's like,
way.
why are we still having this conversation? And
What? And wait, but let me tell you the worst part. So, okay, I'll hit it back.
uh,
After the surgery, guess what the doctor says to me? Says to my husband, we made the right call. It
we
was a nasty, bloody aneurysm that would have ruptured. That's what he was saying. It was a nasty and bloody. We made the right call.
you
What if I
know
would have I would have literally went home to die, Kelly? And how many of our sisters do this because
yeah.
they're told?
Yeah, and I feel when Charles, I'm looking at you, and I'm curious just what you're doing. I want to talk about solutions and talk about the bill that you have at legislation now. To all of you all, the warning signs for women. What should they be looking out for? What can we do? How can we help? And I want to talk about what you have with this bill that you have and your foundation.
Yeah, certainly. So thank you so much for that. And so just when we talk about women, we can get into some of the warning signs, but I also kind of want to just start fundamentally when we talk about maternal care, but care across the board, and that is
Mhm.
kind of our selection and our providers,
Thank you.
right? Um, and this the study that Brother Errol showed about the four-stage study and how what that illustrates when we have representation in the workforce. That's important, right? Um, Not to say that there are not people from other communities that cannot serve Black people and people of color with compassion, but representation is important. Also, I want to empower and encourage women when they are going to select these providers to ask and have difficult conversations because you will gather important things. People say, what should I ask? Well, first of all, and it's important. Are you aware of the maternal mortality crisis and how it is disproportionately affecting Black women?
Mhm.
Mhm.
Question number one. Two, what is it that you in your practice are doing to ensure that I make it home to raise my children? Right? Right. Number three, what is it that you're doing to keep up with the latest innovations and best practices in maternal care, right? Those are all important questions that you can ask. Now, based upon the responses to those answers, you will learn a lot about your compassion, the compassion of that provider. So if they respond, Kelly, and they say, what are you talking about? I'm not racist. I treat all my clients the same. Red flag, right? That's a red flag. Versus if they respond, you know what? It is horrible what's going on and how African-American women are dying disproportionately. These are the steps that we are taking to ensure you have a healthy birth and that you not only survive, but you thrive, you and your child. That's the type of responses you want to see from your provider. And if you get those red flag, defensive, hypersensitivity, those are signs that you should look for another provider, right? So moving forward towards legislation. So here's the thing. We have got to work towards solutions, right? And the good news is that we can fix this, right? There are examples from around the world of countries that are doing things that are turning the tide. We understand the solutions, but what it's going to take is going to take a significant investment and a buy-in from a lot of different stakeholders. It's going to take buy-ins from the obstetrical community. Is going to take buy-ins from providers. Going to take buy-ins from midwifery. It's going to take a lot of buy-ins from a lot of people, but we can fix this. So what we've done is last Monday, in fact, with the help of the Black Maternal Health Caucus, we introduced a monumental piece of legislation to the United States Congress called the Momnibus. And what this is it's a comprehensive package of not one, not two, not three, but 12 bills, 12 laws specifically to address African-American women and women of color who are dying or having poor outcomes in childbirth, right? So first things first, why do we have to make it about Black women? Because if we fix it for Black women, we fix it for everybody.
Thank you.
Right?
Yeah.
And so these laws, and you can, read more about it. We'll give the information so that you can share it with your listeners, and they can go to forcare4moms.com, or they can go to the senatorial site. But this package is going to be monumental in what it will do to providing resources for our community, the research, the data that needs to go into this, and very importantly, transparency in holding providers accountable. And I'm very proud that as a part of this legislation, one of the main laws in here is going to be the Cure Johnson Act, which is dedicated to my wife, Cure. But what is important to understand, going back to the onset of this conversation, is when it's all said and done, Kelly, I can't legislate compassion.
Yeah.
Right? So we have to have a fundamental reset when it comes to our implicit bias training, representation in the workforce, because no law on Capitol Hill is going to get you to see Gessie and her family the same way that you see your wife, right? So what tools are we investing in, right? And my brother here said, bias is quantifiable, right? And we understand how we can measure these biases, and we understand that as medical providers, I make it plain. If you're a doctor, if you're a nurse, if you're a provider of any sort, you have two choices. You need to understand your bias, and you need to either A, take steps to get better, or you need to find something else to do.
Exactly.
Right. Let me redirect this question to you, Errol, because your background, not only with working with Health First, you've also worked at other health companies like Empire, Blue Cross Blue Shield. How do the health companies help the hospital workers? Because it sounds like they have to be retrained. How can you all help how can you all help do this retraining?
It's a great question. So I'll answer in two ways. The first is there's a book by Atul Gawande, amazing physician, called Checklist Manifesto. Checklist Manifesto describes how, like a pilot, everyone should follow the right protocol when handling a situation, right? we have given physicians and the medical industry lots of latitude and discretion to take care of patients. But we actually have data on how to treat diseases. Like a diabetic, you must do a foot exam to make sure that the person doesn't get amputated. Like there's protocol. And so one way health insurance companies can advocate for better care is to say, you won't get paid if you are doing things outside of the normal structure for anybody, regardless of their race, creed, color, whatever, religion, anything. So why did you not provide this drug when every other birth got the drug? Oh, I can't give you 100% of your reimbursement because you didn't do it right. If there's a readmission, so Coach Gessie is let out of the hospital and she comes back in 30 days, why should an insurance company pay in full for the readmission, which means there was a mistake that occurred in the first place? So there are financial mechanisms that can happen on the insurance side, which at Health First, we're the largest nonprofit in New York State, we do that. And then also, this is not just for Good Samaritans, right? You don't just have to be in this to say, well, let's help Black women, you know, kind of like boohoo, kind of sad thing. I love the fact of saying if we fix it for Black women, we fix it for everybody, right? I lifts all boats. This is financial because we waste money on the extra care due to disparities. So there's a study, $230 billion goes to waste on extra care because of the bias issues, because of systematic racism and not doing things right the first time and having the person come back, all these extra surgeries like $1 million baby, that should have never happened. And if we had a checklist manifesto and the right protocol was being done regardless of your race, and there wasn't allowed to have discretion because I'm a doctor or I'm the smartest person in the room, we would have eliminated those costs, which will pay for the Mamios bill. So there shouldn't be an issue of we don't have enough money to do this right now. We're in deficit. It's like, no. Having babies be born and moms be around for them is a savings. Right. So you don't have to be a Good Samaritan to actually get behind this. More babies will be born, more Black mothers will live, and it's actually a savings to the industry.
Very well said.
Yeah, very well said. Charles, were you going to say something else?
I'm just over here being his amen.
Happy.
Right. And Coach Gessie, as far as solutions, you are a big advocate of educating women. And I want you to talk about your achieving health equity, and your BABE acronym stands for what?
Yes. So I'm good. You know, what I like to say is I recommend we have to follow all of our options, right? Meaning we have to fight legislatively. So we have to get behind this momnibus and we have to sign the petitions and we have to rally around it to help make the noise so that we say we require this. And I love what Errol said about we were talking about this, right, Charles? You got to hit them in the pockets. You're not going to legislate care, but you can make them accountable for it. You can make them accountable for the right quality of care. So we have to do that. We have to make sure that we're looking at the doctors and we're giving them, we're holding them accountable and specifically making sure that the healthcare system that we're signed up with. I love to hear what Health First is doing. But at the end of the day, I also equip women. I say, listen, everything that you're doing, you also have to look out for you. Number one, what can you do to control what's going on with you, right? And the way I say it is, I said, listen to your BAE, your BAE, all right? Your BAE is, number one, B is your body, all right? Okay. Because had I not listened to the pain, how many times do we push off pain, Kelly? How many times do we say, I'll get to it. It's all right. Or we endure, especially as Black women, we have this superwoman complex because we've been told we're treated like we're not real, right? Mm-hmm. That goes back to what studies say is that we're treated as we're superhuman so that our pain is not acknowledged properly, right?
Right.
And if I had listened to that pain, if I hadn't listened to it, I wouldn't be here today. Listen to your body, because when it's telling you something, if we don't listen to the whisper, we'll have to listen to a scream. We'll have to pay attention to it when it's a scream. Absolutely. And what that means is also, so listen when your body is talking to you, and also focus on being proactive with prevention. That means, we're made sick by what we consume mentally and physically. And good health starts with controlling what we consume. That means, you know, my company is Detox Living. Yeah, that is life free of toxic thoughts, people, habits, and foods. Right?
Facts. Yeah.
I can control that. What's the toxicity of my environment? Because disease is an oncoming train. And because we abuse ourselves, but we can reroute that. We can reroute that and say, you know what? I'm going to change the what's coming with proper sleep, proper exercise, healthier relationships. And at the end of the day, that, you know, for me, equipping women to be preventative, that's a very important. That's why we created this free detox living challenge, just to equip people with a challenge that helps them change their thinking
Right.
and their eating, specifically to allow them to live healthier lives, right? And then the A in Bay, so it's B is body, A is advocates. We need to surround ourselves with a tribe of advocates. Advocates right now are Charles Johnson is one of your advocates, okay? Errol, Pierre, and what they're doing at Health First, that's one of your advocates. Coach Gessie is one of your advocates. And then you have your own personal tribe of people who are going to say, listen, no, don't ignore that pain. No, you know what? That doctor, like what Charles said, what did he say? Oh, no, that's a red flag. You need to go get another opinion, because if that care, we have to hold. Remember what I said to that doctor? I said, I'm not going home, not until we get this under control. Unfortunately, too many of us feel like there's this patriarchy with doctors, whether they're female or male, meaning this pedagogy is really the real word. That it's like, well, you're the teacher, I'm the child, you're the parent, I'm the child, and whatever you say goes. I had to literally stand up to these double board, surgeons and say, listen, I'm not going anywhere till I know I'm not going home to die, right? But I had the support system that said, yeah, no, we're going to fight with you, or you're going to find another doctor. And the experts, number one is the E in Bay is experts. You become the expert of your health first and foremost. You be your most important advocate, okay? And that means do the research, listen to this information we're giving you, okay? Do the research, but listen to your gut. When you feel like he said, that those three questions were phenomenal, Charles, like, because that gives you a locator. It locates you on where those people are. And I would ask any doctor that. I'm gonna use that. I love it, because the point is people locate where they are and they let you know whether or not they have the privilege of being on your team. All right. And so multiplicity, don't be afraid to fire a doctor, to hire another doctor. Don't be afraid to do that. And here's the thing: when you feel that you possibly are being biased again and you have questions, call it, name it. Name it and say, you know what? I feel I'm being biased against. I'm being discriminated against. I want to see someone else in the hospital, or I want to see another. Name it, because that accountability right there. Charles, you about to say something? Go ahead.
Yeah, I just want to say something. You made me think of something that's also very important too, from a practical situation, about calling out the bias, identifying it. And I think that, like I said, we talk about this view that doctors are infallible and that they don't make mistakes, they're human, right? And understanding that they're human, understand that nobody knows you better than you. But it's also important, this is another tip that I want people to do, because I know that it's important to also call out what's happening in your care, but also very importantly, what's not happening in your care. For instance, if you are in a situation and you, like Gessie were saying, you feel that you need additional screening, or they're trying to send you home, or they refuse to give you a particular medication, what you need to do, very importantly, is you need to say, okay, I want you to document in my chart that you refuse to do this particular, and watch how quickly that medication shows up.
That's good. That's
right.
That's part of that accountability, Charles. Right.
That's where that bias comes in, because they will size you and say, well, she doesn't really need that, or we're going to just wait and see if we need to do these tests, right? Because they're thinking 2 and 3 steps ahead, because we don't know what type of, sis may have this insurance that's only going to give us partial reimbursement. We don't know if we're going to send her all the way down the hall to get this, whatever $1 zillion, right? So we have to be able, and other thing too is a couple things happen, right? Is there is a manner in which we can show up and we can be assertive, informed, and not confrontational. I think that very much often we are concerned about the manner in which we are perceived as angry Black people, but there is a power in being resolved and convicted, and being able to communicate effectively, right?
Mm-hmm.
And that is something that we have to empower all people, particularly people in our community, with the language, with the simple terms and questions to ask, even things like knowing, understanding, and where to find your patient's Bill of Rights.
Mm.
Majority of institutions have them. In New York City, where you are, I know that there has been a big response to the maternal mortality crisis and how bad it is, that they have instituted particularly a birthing Bill of Rights, particularly for New York City and all the boroughs. So these are resources that are there, that anybody from any walk of life can access and have at their disposal to help them navigate their experience.
It made me, when you talked about that documentation, Amber Isaac tweeted about her incompetent doctors. And I think that is helpful, and that helps other women who, in this time of being pregnant during COVID, because they're only having virtual appointments now.
Yeah.
And I think documentation is very important. I wanted to say thank you so much for saying yes to come and speak to everyone, because it's these conversations is going to help the next people. And Charles, I wanted to ask you, how are your boys?
Oh, thank you so much. They're doing really good. They're doing really good. Never a dull moment. So they are 4 and 6 years old now.
Wow.
They just really are super smart, just very kind and loving, and they got stuff from their mom. I chose wisely. That's how I did, is make a good choice.
I want to commend you, all you all, for sharing your stories. I have to say, every time I see a picture of your wife, I feel her warmness and her beautiful spirit. And I know that it resonates through the boys. She's always going to be with you. And I just thank you. And for people who, I know you're still taking signatures for your petition, how can people sign the petition? How can they help? Give us more information on that.
Sure. Thank you so much for that, Kelly. So what we really need to do is we're asking people to really put pressure on their congressional representatives to support this Mom to Bus Act. And so if you go to the number 4 KIRA, the number 4 MOMS, that's 4cure4moms.com, and you click on, there'll either be a petition tab or a take action tab, and it'll take you to the petition. Literally in 30 seconds, you can enter your name, email, and address, and it will automatically create a letter for you that will go to both of your senators, as well as your congressman, as well as President Biden. Just like that. It's free. It costs you nothing. Your information won't be shared. So please, if everybody would sign the petition, share it with your mama, your cousins, everybody. Please share it.
Share on social media, on your platforms, share it. It takes a village.
And Charles, how can people follow you, follow the foundation?
Yeah, certainly. So it's the same thing. It's 4cure4moms on all social media. The number 4 KIRA, the number 4 MOMS.
And Charles, I'm sorry, on all social media platforms. And Charles, please tell us, you're SVP for state programs in the state of New York.
Errol.
I said Charles.
Charles,
Errol.
I'll clock in.
Take it, Charles.
I'll clock in for you.
Thank you. I
was like, Gessie, you didn't tell me I was getting a promotion. What?
Look, where the money resides. Errol, tell me what's on the forefront for Health First and the state programs here in the state of New York?
Absolutely. So we insure over 1.6 million members in New York City. Many of them are essential workers. Many of them were impacted by COVID-19. So we're actively getting people vaccinated. I'm volunteering at different vaccination sites, making sure the most vulnerable populations are getting the vaccination.
Mm-hmm.
We also are working with our hospitals around quality programs. So we actually will pay more for doctors and hospitals that have higher quality, higher standards. And so we're putting that program into place this year so that, for example, a doctor would actually get a bonus if they incentivize their members to go back for prenatal visits.
Wonderful.
So those are some of the activities we're doing. The other thing I just mentioned is we didn't get into doulas or midwifery.
Yes, I was just going to say that. I'm so glad you brought it up.
Under the A that Coach Gessie talked about for advocates are doulas and midwives. They are like Secret Service agents to a Black woman. They will fight for you. I know many of them, and if they have, if your insurance covers that benefit, that's definitely an option for you. Because when you're asleep, you still need someone to advocate for you. You know, when your eyes are closed, you still need someone asking the nurse questions, asking the doctor questions, and being a dog on the bone for your care.
And I think a lot of people don't, and that is a great subject to bring up doulas. How would that affect, because not all health programs cover doulas. Gessie, maybe you can speak more on that, because that's more on the natural homeopathic side.
It is.
How can that?
So here's the deal, right? So Errol and I were just talking about this offline this morning, how one of the things we'd love to see in this Momnibus Act is coverage for doulas, all right? I know that's in the Kara Johnson Act that's involved in the Kara Johnson Act, right? Charles. So because, that's change coming, right? But it's just like people who, whether if you're a woman who's looking to transition to a healthier lifestyle and you come to us, this is not something that's quote unquote covered. It's a holistic care, right? Just like if you come to us because you have fibroids and you're looking to reverse the fibroids or heal, holistically heal these issues, or, have fibroids eliminated naturally, or having miracle babies. We have another woman, and we have so many miracle babies. I just got a message this morning, another woman having a miracle baby, which is phenomenal. But it's something they have to pay for out of their pocket or through their FSA. There are FSA programs that allow them to pay for it. But at the end of the day, I have to encourage women, because the truth is your life is worth it, right?
Yes.
So it's something that right now we're looking to fix it so that it's included in your healthcare system. But right now it has to be something that, because of your value, that you need that support. So it's something that helps you, helps you specifically to live a healthier life where you are empowered to do so. And the truth is, at the end of the day, when we see this, it's just like Errol said, it's better in terms of the long term, in terms of better outcomes, in terms of longer repercussions, which require more care later down the road, right? So if you have more support early on, whether it's preventive care with, all right, you deal with inflammatory conditions with the lifestyle changes of one of our detoxes, right? So now you're not dealing with high blood pressure, so you're not more at risk in your pregnancy, right? Or just in general, right? Or you're dealing with eating, you're bringing a doula on, and you're taking, you're now adding that to and you're having to pay for it out of pocket. Now, understand that you're going to have the advocacy you're going to have at the table is going to prevent so much more. It's going to protect you from so much more. So we know our job, I know all of us here want to fix it so that it's all included in your healthcare, right?
Absolutely.
But understand that we're just filling in the gaps where we can so that everybody is covered in every way we can.
Charles, you wanted to add to that?
I have one thing that's important for everybody to understand about doula care, right? First of all, doulas matter. I'm so glad that you grounded us and brought that up. Doulas matter, midwives matter, so important, particularly to our community.
Yes.
It's important also that we understand what doula care is, what it isn't, and that we dispel myths and propaganda that has been created by the medical establishment towards doula care, right? And a lot of times women feel they have to make this very hard choice about doula care, or do I want a traditional hospital birth, right? And then it's all this whole, I'm going to be in somebody's basement, or am I going to be in hospital surrounded by doctors? But the reality of the situation is there are so many different blended types of care, right? You can have an integrated model of care where you're in the hospital with your traditional doctor, and you have that midwife or that doula there as additional support. You can go the complete home birth route if you want, but there's whatever you're comfortable with, there is a birthing plan and a model of care to suit your needs, right? If you're like, man, like I love this doula thing because I love the warmth and the compassion and the personal care that someone brings me, but I really feel that I was born in a hospital. I want my baby to be born in a hospital, just in case. That can happen, right?
Right,
You can have it. The idea and the key is making it accessible and affordable for everybody. And we're proud that we're taking some important steps to that.
That's a
Yes.
critical piece right there, Charles, because I think that people do polarize that decision. They think I have to go one all or nothing, right?
Yeah.
And it's not true. It's really the integration of what you need, because not only do the doulas provide the support, the care, right? But they also provide insight. Insight meaning having seen expertise, like, wait a minute, this birth is going the wrong way. No, we need to push for this. No, we need to push for that. Things that you wouldn't know, right? And that expertise that has saved lives.
Yeah.
So very important.
You know, I think that we definitely could have a part 2 to this. And, you know, this conversation is going to be ongoing. I will be inviting you back. But thank you for your time. Coach Gessie, Errol, Pierre, please let people know how to follow you, how to get in touch with you, because I'm sure that it'll be more questions.
Obviously. Thank you so much. If you are a woman battling fibroids or some reproductive issue, or you're looking to transition to a healthier life, like I mentioned, we have thedetoxnow.com. That's www.thedetoxnow.com, where you can book a free group consult or a private consult. Also get our free, free resources. And we also are coming out with our balanced prenatal supplement specifically for women who want to have healthier protocols as they're in birthing and bringing new life. So at thedetoxnow.com, and I'm Coach Gessie on Instagram. Very, very engaged and very here to support you. Be my honor to be a part of your tribe.
Thank you. And Errol.
Yes, thank you so much, Kelly, for the opportunity. Coach Gessie, Charles Johnson, you guys were awesome. So at Health First, it's Health First New York on all social media. You can follow us. We post tips and tricks and things like that. We give information about enrollment. For example, Biden just extended the opportunity to enroll for Obamacare till May 31st. So if you need insurance, you have more time. And personally, I'm at Errol L. Pierre at Instagram.
Okay. Well, thank you, everyone. Please do your research on your own as well. Google Black maternity mortality. It's so much to learn, so much to grow from. It will help you. I want to thank everyone for watching First Aid with Kelly Kinkaid, and follow me on all social platforms, Kelly Kinkaid, Kelly Kinkaid. Thank you.
Thank you, everybody.
Thank you.
Thank you, guys.
It's First Aid with Kelly Kinkaid.